let's dive into talking about the good morning movement. I'm Dr. Nichelle Gurley, and I'm specialized in prenatal and postnatal movement. The good morning is a wonderful movement for most people, but I love it during pregnancy because oftentimes squats can irritate people. There's a lot of other movements that can irritate the pregnant pelvis and belly and low back. But good mornings seem to be a really great movement for a lot of people, and it's a great movement to help work on areas of the pelvis and the low back. It's always great to be adding rehab into your prenatal routine, especially if there's pains and discomforts, and good morning is absolutely one of those movements. So for the good morning, you're going to be slightly wider than shoulder width apart. You are going to think about driving your hips, driving your butt back. What I don't want to see is a squat-like movement where your knees are squatting down or that your torso is pancaking over like this. So you won't go beyond 45 degrees. So if you're finding you're not back far enough, you don't pancake over more. You will drive back into your hips more. You'll see that my knees are bending. So I'm not stiff legging it like this. You'll see that I have a knee bend and a hinge in my hip. And so if I'm not getting the range of motion I need, I don't drop into my knees or pancake over. Again, I think about how can I drive more into my hips. What are good signs that you're doing it correctly are that you're not squatting too much or pancaking over, but also that you start feeling a stretch between your knee and your sits bone because your hamstring is getting stretched. So you're feeling a hamstring stretch because your knee and your sits bone are separating out farther based off of this hip hinge. So let me show you the pattern. So I'm going to drive back into my hips. You can kind of even see my toes start lifting a little bit. I don't want them to lift up so much. I don't want to be gripping like this where my toes are coming off the ground. But if you feel that they're working to stay on the ground, you're probably getting that hinge correct. And then I'm going to drive up with my glutes. So a couple things I want you to think about is the breath is going to be inhale down, exhale and engage that deep core on the rise. If you don't know how to engage your deep core, I have another video called Deep Core Engagement for Pregnancy. But one thing I'll talk about here is a pelvic lift that you'll do. And I like to envision that when I engage my glutes, I'm scooping up my lower belly. So it's this kind of scoop motion together. I like to think about my pubic bone reaching up towards my belly button. So I'm not gripping my abs. It's a lower belly lift of that pubic bone coming up. And again, it's also not a tucking of the sacrum. So it'll look like this. Inhale back. Engage my glutes. And lower belly. Exhale on the rise. So I'll show that again. You can keep your hands on your hips as you do this. Another option, if that gets easy for you, is your arms can go up overhead. You don't want your shoulders coming up like this. They're going to be down and back. So you're going to think about those shoulder blades coming down into your back pockets. So you're going to down, hinge back, same thing. You're going to inhale, exhale, scoop up that lower belly, activate those glutes. If you're having a hard time with balance on your own, you can put the wall behind you and you can tap to the wall and then come back up. Hinge to the wall and back up if you're worried about falling backwards. But again, we don't want to pancake over. We don't want to squat. We want to be hinging into those hips to really get that full effect. Because you're pregnant, I really want you to think about that lower belly scooping up as you engage those glutes.